Good day po sa ating lahat. So I am from Group 10 Microbiology and I am here to discuss about antimicrobial susceptibility testing or AST. So let's start na po. So why the need to perform AST? So first, it is performed on bacteria isolated from clinical specimen to determine which antimicrobial agent might be effective in the treatment of infection caused by bacteria, or it is performed on clinical specimen to determine the probable causes of patient's infection. So this specifically applicable to Staph aureus enteric bacteria and certain unusual species playing a pathogenic role in the human body. So take note that susceptibility testing should not be done on definitely non-pathogenic or to the members of the normal flora of their normal habitat. So for example, E. coli are normal biota in the lower gastrointestinal tract and therefore would not be tested when isolated from stool. However, E. coli from blood culture would be tested because, di ba nga, blood should be sterile. Similarly, very dense group streptococcus specimen would not routinely be tested pag nakita sa throat natin. So, gets ba natin? Yeah. Moving on to the methodology, in clinical laboratory, susceptibility testing is usually performed by either disc diffusion or dilution or MIC. So, here are different methods that can be utilized when doing AST. So first po is disc diffusion that can be classified as 1, Kirby-Bauer method or Stokes disc method. Second is the dilution method that can be classified as agar dilution method, broth, macro, and micro dilution. Other method includes the following. So andito yung D-test, oxacillin disc, and lastly yung automated AST system. So ang dami. So what are the standard components and consideration when doing AST? So first po, our bacterial inoculum. Pangalawa, culture media, the incubation temperature and time, atmosphere, and lastly, the concentration of the microbial agent. So note that your inoculum should be pure and standardized, obtained from 3 to 5 colonies of the same morphology. Turbidity of the suspension should be that of the turbidity of the Mcfarlane Standard that has an optical density of 1.4 by 10 raised to 8 colony forming unit per ml. Incubation temperature should be at 30 to 35 degrees centigrade. Take note also of the atmosphere when incubating, the concentration of the antimicrobial agent, and lastly, the culture media. So for the culture media, here are some or lists of specific broth and agar agar media for specific bacteria. So pag nakikita natin, mostly yung ginagamit is Mueller Hintonagar. There are several methods that can be utilized when doing AST. But for this specific lecture, we will limit ourselves only to the disc diffusion method, also known as Kirby-Bauer test. So why Kirby-Bauer method? Because it is simple, reliable, and most widely used in the laboratories. So ano nga ba yung mga requirements when using Kirby-Bauer method? So first po, MHA or Mueller-Hinton agar that has a pH of 7.2 to 7.4. Depth of inoculum should be 4 millimeters and the size of inoculum should be 1.5 by 10 raised to 8 colony forming unit per liter. Incubation time of about 16 to 18 hours at 35 degrees centigrade. And lastly, the size of the filter paper should be 2.4 to 2.6 millimeters. So eto yon. What are the advantages of Mueller-Hinton-Agar? So one po, it has shown to have a good batch-to-batch reproducibility. It gives satisfactory growth and not antagonistic to most antimicrobial agents. So, eto din, pH does not change during the growth of bacteria and is approximately isotonic with blood, thus can be used on certain fastidious organisms that cannot grow on unsupplemented medium alone. Last and most important advantage is that it is readily commercially available in the form of dehydrated culture medium and prepared plates. So here are a few definitions to know before proceeding to the procedure proper. Minimal inhibitory concentration or MIC is defined as the lowest concentration of antimicrobial agent that visibly inhibits the growth of an organism. MBC or minimal bactericidal concentration is the lowest concentration of the antimicrobial agent that result in the death of an organism. If the organism is killed or inhibited by the concentration of the antibiotic, there will be no growth, thus the term zone of inhibition. Mcfarlane Standard is a barium sulfate standard against which the turbidity of the test and the control inocula can be compared with. So take note that in such case that the suspended specimen is more turbid than that of the standard, the inoculum would be diluted with sterile tryptone soy broth or with the normal saline. In such case that the standard is more turbid than the suspension, you may add more colonies to the nutrient broth. MHA or Mueller Hintonagar is used as a subculture agar media in Kirby-Bauer method. And lastly, the control strains. So this is used to test the performance of the method. This can be obtained from reference laboratories or can be commercially purchased. The control strains should be grown on slope on nutrient agar or tryptone soya agar and stored at temperature of 2 to 8 degrees Celsius and should be subcultured every 3 to 6 months. So examples are the following. So E. coli for gram-negative bacteria, Staph aureus for gram-positive bacteria, Klebsiella pneumoniae may also be used, and P. aeruginosa, and lastly, fecalis. For the procedure, always wear your PPE, culture specimen on appropriate media, incubate overnight to get isolated colonies for testing, remove MHA and antimicrobial disc from the refrigerator and allow to stand at room temperature for about 20 to 30 minutes, and yun. Refer to the following video for the procedure na lang po. The prerequisite for any AST procedure is the presence of the isolated bacteria from specimen obtained from the patient. Wear your PPE and culture specimen on appropriate media. Incubate overnight to get isolated colonies of bacteria whose sensitivity is to be tested. Remove the MHA and antimicrobial disc from the refrigerator and allow to stand at room temperature for 20 to 30 minutes. Wear your PPE and label the tube containing the nutrient broth, mostly TSB, in which the colony will be suspended. Using a sterile wire loop, touch 3 to 5 well-isolated colonies of the same morphology and emulsify to the TSB or saline. Incubate the tube for 2 to 5 hours to produce suspension of moderate cloudiness. Match the turbidity of the suspension to the 0.5 Mcfarlane Standard in a good light. It is best read using white paper with black straight lines as background. In such case that the suspension is more turbid than that of the standard, it may be diluted with sterile broth or normal saline. In such case that the standard is more turbid than the suspension, you may add more colonies to the nutrient broth. Shake the tube well before use. Using a sterile cotton swab, inoculate a sterile MHA by streaking evenly in 3 different directions on the surface of the medium, also known as the lone stroke method. With the Petri dish in place, allow to dry 3 to 5 minutes but not more than 15 minutes. Using a sterile forceps or a multi-disc dispenser, place the antibiotics disc evenly distributed in the plate. Take note, It should be 15 millimeters from the edge of the plate and no closer than 25 millimeters from disc to disc. No more than 6 discs should be applied on a single 90 millimeters Petri dish. Each disc should be pressed down to ensure contact with the agar, and it should not be moved once it touches the surface of the agar. Inoculate the control strains. Take note that the Mueller-Hinton agar plate should be of the same batch as the test plates, and the antimicrobial agent should be similar to the ones that is applied on the test plates. Incubate the control and the test plates within 30 minutes anaerobically at 35 degrees centigrade for 16 to 18 hours. After the incubation period, examine the control and the test plates to ensure the growth is uniform. Use a ruler to measure the diameter of each zone of inhibitions in millimeters. The end point is where the growth stops. Refer to the following slide for the Zonzai's interpretation. As for the interpretation, it had been standardized and defined by CLSI guidelines, quote-unquote, performance standard for AST. So, susceptible or S indicates that an organism is inhibited by the recommended dose of antimicrobial agent at the site of infection. Intermediate or I represents that an organism may require a higher dose of antibiotic for longer period of time to be inhibited. Resistant or R indicates that an organism is inhibited by the recommended dose of an antimicrobial agent at the site of infection. So this is the reference for several organism group provided by the CLSI, where you may compare your measurements. So once the measurement have been made, the millimeter reading for each antimicrobial agent is compared with that specified in the interpretive tables of CLSI documents. And the results are interpreted as susceptible, non-susceptible, intermediate, or resistant. So that's it po. Thank you so much for your attention. Okay, done.